Hello, hello. Welcome to another heart-to-heart conversation. Today, it's an honor. We are joining forces together, all the providers from Counseling of El Paso, and we will be dedicating this conversation to mental health. May is Mental Health Awareness, so we are dedicating this conversation to talk about the importance of mental health too. We will introduce ourselves, but first we just want to clarify the intention behind this conversation is really to provide education, promote awareness, and it does not replace or substitute any form of consultation or replacement of counseling or therapy. If you feel you would benefit from it or a loved one would benefit from it, we always recommend seeking a professional and individualized support. Really, this is really to build awareness and provide education to the community. Feel free if you want to comment. Just keep in mind that it isn't confidential, it isn't private. So if you participate, being mindful of that. We encourage it, of course, if you feel comfortable. My name is Jasmine Silva. I am a provider here at Counseling of El Paso. I'm a licensed professional counselor in Texas and also a registered play therapist as well. And it's an honor and I'm very grateful to be here today. Hilda?
So my name is Zelda, and I'm also a provider here in Counseling of El Paso. I am licensed as a mental health professional here in the state of Texas and in the state of New Mexico. I'm also certified as an anger management therapist and trained in EMDR.
My name is Guillermo Castañeda Sr. I'm hypnotherapist here at Counseling of El Paso. I'm working with hypnosis, clinical hypnosis, for 42 years ago. It sounds easy.
And my name is Guillermo Castañeda. I'm a licensed professional counselor here in the state of Texas, and I'm also the director of Counseling of El Paso.
All right. So today we will be talking a little bit about the stigma on mental health, right? So when you think of mental health, what are some of the words that kind of creep up, right? It can be from, oh, it's all in your head, or, oh, you sound crazy, or, that doesn't seem very good for you to do or very good to feel, right? Think about the people that say, well, I don't really feel anything, right? I can't deal with emotions. All of these things are stigmas, right, of what mental health is, right? Remember, mental health doesn't necessarily consist of, a disorder or a great emotional reaction. Mental health is being able to feel regulated within yourself, right? And when we start to use a lot of these words that stigmatize what mental health is, our mental health can suffer, right? So what do I mean? Think of the times that you've ever felt crazy, right? What does that mean? What does crazy mean? Think of our history. Anytime somebody went out of a norm, where were they put, right? They were put in insane asylums, what they used to be called, right? Or madhouses, right? Think of those words, insane asylum, mad houses, right? They all are part of the word crazy, right? So we don't want to be part of that. We think of like the movies, oh, people are screaming and people are yelling and people are, not in touch with reality, right? So it's very important to be very conscientious about how we're using these type of words when talking about mental health, because mental health can be as simple as getting a massage, right? Mental health can be as simple as going for a walk, doing something pleasurable that helps you reduce stress, right? That helps you enhance positivity, right? And the more we start to use these words, right? Mental health, positivity, we give a different form of concept for mental health. Because how come we are treating physical health any different, or mental health any different from physical health, right? You don't tell somebody that has an illness, a physical illness, to just get over it, right? You don't tell somebody that has a physical illness that they're invalids or that they are useless or anything like that. So how come we're kind of using it for mental health, right? Where do you feel this is all coming from? This is coming from the society that we're kind of growing up in, or that we are developing, right? Because we're still using these type of words, right? Think of even in a smaller constellation, family, right? How does your family feel about mental health, right? How does your parents, your siblings, your aunts, uncles, grandparents, so on and so forth, how does your culture feel about mental health? Because every culture is different, right?
Yeah, exactly. And I think one of the things that we need to talk about is that minorities seek mental health less than the I guess the majority, and the reason why is because there's this closeness. There's a lot more of a family closeness, and as minorities, we're expected to talk to our parents or talk to our whomever in the family, and nobody in the outside. You don't you don't tell anything. So when we were talking about the access also to healthcare is less than what the dominant majority has, and so it there's not enough information, so no education about what mental health really is, and I think that's one of the things that we're trying to do in here. We're trying to educate everyone as far as mental health because it's okay to ask for help. Men need to ask for help also. We notice that there's a lot of stigmas, and not just mental health, but you cannot cry, you cannot complain, you need to be strong, you need to be the provider, you need to show this face of a protector all the time, and so you definitely cannot say anything, cannot do anything, and it's really important for men to understand because if we notice the statistics, the crimes that are committed by men, they're they're higher, and a lot of those could be prevented if the man could actually show his emotions or his feelings, or he could actually let everything out. There's this thing that we're like a pressure cooker that we just keep on get it, and it's gonna explode somehow, and it's gonna explode in some way. So men need to also go and get help whenever they need to. That's what counselors are for.
That's right. And what I would like to add to that too is there are implicit messages we receive culturally, in our families, in society, in regards to what it means to receive help. And really, as human beings, we receive help from the moment we're born, right? It's something that we have needs that are being met. That is the way we're wired. And sometimes what happens is that in our cultures, there is labeling that occurs, and a lot of the times we feel identified by those labels, and in this case there are certain terms that can be used that dehumanize us, and whenever we are dehumanized, we always have to talk about shame. So what shame is, we feel seen through a lens from another person, from whatever cultural norm or whatever other is coming from. And typically this is a lens of we're not enough, there's something wrong with us, we're not measuring up to whatever it is. And sometimes it could also come from feeling compared to as well. And also what happens is that, like Memo is describing, is this feeling inside that we feel, and really helping mental health, especially when it comes to doing this type of work. It helps us be able to name it, to tame it, and change it in adaptive ways, in helpful ways, where we don't hurt ourselves and we don't hurt others as well. So that's really what it what we do here. And when it comes to shame, really the antidote always is really compassion, honoring someone's truth, someone's story, listening and validating. Those are very important. And always remembering too that we're not defined by labels, diagnosis, or experiences that, and of course that is a processing, that is a journey to be able to feel I am more than what I experience. I am more than this. In a way where it feels like Elda was describing, we feel in alignment, we feel integrated in ourselves. And there's that beautiful synchronicity in our internal landscape. So Mr. Castañeda will now explain what are some of the signs sometimes when we feel we may need help.
Okay. Question is here. Have we signs we have lack of mental health? Yes. Another question is, the lack of mental health is a disease? The answer is not necessary. Not necessary. How can it be possible? Well, the DSM-5 says, I can define lack of mental health as the incapacity to live a normal life. But it's not necessarily a disease. It's just a disadjustment. Okay, then if I have fear to make front to the problems of the normal life, I have a problem. I have a problem because this is not normal. When I can't make front to the conflicts with other persons, it is a disease? No. Again, it is a problem? Yes. It is a problem. It is a disadjustment. Then this is lack of mental health. Lack of mental health says, okay, I need to go to a doctor, to a physician, to a neurologist, to a psychiatrist. Not necessary. You can go with a psychologist. The psychologist is not treating diseases. Is treating problems of behavior, problems of perception of the persons. Okay, this is very important to say it, because it's normally one of our fears. If one person is making me feel bad, this is a big problem, not necessary, but it will be necessary to see a doctor, to see a psychologist, to ask for help. It is necessary because I can't to confront a person. They can be my wife, they can be my brother, they can be an uncle, but I can't resist to talk with him. Okay, then you need help. It's necessary to be aware of the signs to need help. Almost the integrity of our body, it depends of this kind of problems, because our mind is responsible of 95% of our diseases. Then we need to treat this problem. We need to ask for help, a counselor, a psychologist, but it is necessary. It is very necessary. Then can I go with my favorite uncle? Better no. Better no. Or with a priest? Better no. Better ask for professional help. Okay?
Yeah, and I will second that on how it's much better for somebody from the outside to see the problem. Many times our relatives will not tell us everything, or they'll be too harsh because there's no they want to help us. They really want to help us, so they'll do anything to help us. But at the moment, we just need to be listened to, and so sometimes that won't happen in the family. When it comes down to promoting mental health, I think it's really important. I think one of the things that we need to do is we need to say it's normal. It's normal for a person to go see a counselor. I think that Elda was right when she said that we say the physical things. Hey, we get to go to the gym. Yeah, okay. I tell everybody I go to the gym. I post it on Instagram. I do everything, But can we tell each other, hey, you know what? I went to see someone. I went to see a counselor because I needed some help with my with whatever simple issue maybe that I had, but I needed some help. And I think that it's really important to come out now and say it. And it's really important for to normalize it at home too. From the very beginning, before we talk about counselors, before we talk about anything, we need to allow everybody to speak out about their feelings, about their emotions, about their problems, and kind of like what we were talking about. Well, maybe not the uncle. Well, maybe the uncle needs to be there to listen, to just be a soundboard. We don't need family members to try to resolve our issues because, they might not have the guidance to help us resolve the issue. But if they can just hear us out whenever we have something, if we see a little kid, a little boy cry, by all means, don't shame him. In fact, ask what's going on, just as you would anybody else. And I think that it's really, really important because mental health is normal, just like our physical health, just like our spiritual health. I think that we need to start looking into it.
When we're talking about listening, guys, it's really important to also listen to our physical bodies. Think of how many times our physical bodies has told us, hey, you're pretty stressed, or you're having an anxiety attack, or you're feeling really depressed. Think of the symptoms that your body is kind of experiencing when you get to that brink, right? Let's take stress, for example. You start to feel the tensions in your shoulders or a headache, right? Tension in your face, in your jaw, pain in your back, tension in your legs, things like that, right? Take, for example, also an anxiety, right? You start to feel the pressure in your chest, right? Maybe the high blood pressure is kind of kicking in, right? Whether or not you have it. You start to feel antsy, you're starting to sweat. Our bodies are going to be the first person or the first being that's going to tell us, hey, something's wrong, because our minds just run, right? Think of the million things that you have to do throughout one specific day, right? your brain is not going to stop and say, oh, wow, I'm stressed, right? Your brain is going to say, we need to keep going. We need to keep going. We need to keep going. And your body is taking the brunt of it, right? And your body's going to tell you, hey, you're pretty stressed. We need to take a break. When we don't listen to our bodies, right, we just kind of pile things on. It doesn't mean it's going to go away. Just because we don't think about it, this out of mind, out of sight, out of mind type of thing doesn't work with mental health, right? It just kind of puts it in a box and puts it away for a little while. Okay, right now we can't touch it, but we're going to need to come back to it. And if we continuously do that, think of how many boxes you're going to end up having on the side. And your body's going to start to have to carry them, right? So being very mindful of, hey, you know what? I'm having this tension. What is this tension saying to me? If my shoulder could talk, what would it be saying? Oh, you had a really stressful day. Think of A, B, C, D, all the way to the Z, right? Oh, okay. So what do I need to do to be able to help myself, my mental health, right, for the next day? Well, maybe my body needs to go to the gym. Okay, what does my mental health need? Well, my mental health needs to kind of decompress, right? Whether it is journaling, whether it is talking to somebody, coming to counseling, right? Being able to bring it all out because it's important, right? And our bodies are going to be the first one to tell us. Think of all of the chronic illnesses, right? All of our chronic illnesses consist of excessive stress, right? It's been years and years of piling up those little boxes we kind of talked about that our body's like, oh yeah, no, we're going to need to do something about this because it's been X amount of years that, you know, we were going to come back to it, but we never did. And I'm tired now. And our chronic illnesses get agitated with whatever stressors we're experiencing. Let's take it a different notch. Think about clients or people that have cancer, people that have migraines, people that have, you know, things like that. What is the one thing that doctors usually tell you? You need to reduce your stress, right? Because now our body's like, oh yeah, we're going to need to pay attention to these things because stress, you know, all of these things cause a lot of damage. And it's important to be able to come talk about it, process it, right? Because then it's a preventive to physical illnesses.
That's right. And like Elda is describing, what happens is that there are situations that can compromise our immune system. And we start experiencing changes in our eating or our sleep or our motivation, or we start noticing that we feel more irritable or on edge. Those are signs that we are experiencing stress or high stress, or in some cases, even trauma. And the best time to be able to process stress or stressors that we are experiencing is while we're going through it too as well. Because we are able as human beings to be able to say, I'm going to take these lessons, I'm going to take these insights and gifts that emerge sometimes from stressful situations and being able to release, transform, or heal anything that really no longer serves us. So those are important elements of what it is to be able to take care of our mental health, because we're not just cognitive, we're not just the mind, we're mind, body, and spirit. And one of the things that I wanted to add, when it comes to, we were talking earlier about really validating, listening to individuals who might be experiencing difficulties, while still being mindful that there might be times where even as loved ones of someone, we might notice that they might really benefit from talking to someone professionally, one-on-one, where they can have that place, safe space where they can process, learn from the experiences, understand themselves better, understand the context, situations, or patterns that are going on in their life, or family life, or relationship life. And to do that, really it is by setting an invitation to that person. So for example, let's say you are talking to a friend or family member and you notice that it's a pattern that they really are having a difficulty coping or adjusting to certain changes. It is okay to be able to say, have you thought about the possibility of maybe seeing someone, talking to someone? And typically it is in that way. You want to provide it in a way where it's an invitation, an encouragement. And if it feels right, you may also self-disclose. In some cases, it may be, I've been through this type of work. I've seen someone or I've talked to someone and it has been helpful, as a way not to make it. Sometimes individuals feel that, well, I don't want to make it about me. And it isn't so much about doing that, but setting an inspiration, providing the other individual hope. I processed this and this is what outcomes I had, and it was very helpful. That hope is so important. As we've talked through our heart-to-heart conversations, that's always an antidote to life. Change is always possible. We will be sharing some links at the end of our presentation so that you can have access. Of course, we're an organization here in the community, but there's countless of providers available as well. So we'll be providing some of those links below.
I think that it's really important to talk about is, when a person comes to our office, first we need to understand who the counselor is. We've had an education, actually a master's degree, and some people even the doctorate, where we actually went through an internship process to make sure that we're doing our job correctly. And so a counselor, a good counselor, what he or she will do is they will actually not bring any kind of their values. They'll leave them outside the door. They'll understand that everybody that comes into the office has their own culture. And so there should be no judgment as to what's going on. And the person, at first, yes, it's kind of awkward to open up to somebody, but it gets so much easier. And just to know that person is doing it, is hearing you out unconditionally, it brings that relief where you can actually speak out and just say anything. It is a process. In fact, one of the things that I would say is that if you notice that there's something off, right away, make that appointment. Because the faster that is caught, the easier the process is, actually. And so the process, it might have its ups and downs as we go along. But that's part of the process. Sometimes when we have an appointment, sometimes it might even get a little bit harder. But I always tell people it's kind of like when you go to the dentist and they probe and then they find that cavity and then it's really painful. Well, sometimes it's just finding that so we can heal. That's the whole point of the counseling. It's to be able to heal whatever we're going through, and just living a better day-to-day life. And so one of the things that I wanted to say is that if you wanted to make an appointment here at Counseling of El Paso, we're over here at 6955 North Mesa, Suite 304, and that's Mesa and Wrestler. And you can also visit our website. It's www.counselingofelpaso.com. Even here, you must be seeing this on Facebook. So this is our Facebook site. And our phone number is 915-209-1234. 915-209-1234. And if you need any kind of help from us, or if you need a referral, by all means call us and we'll be happy to help you out. Even if you're not our client, we want to make sure that you're doing well.
That's right. We'll connect you to the another facility, organization, clinic, practice, provider. And I will add too, if you are a professional yourself and you would like to join our team, we are hiring. So if you'd like to, you can also visit our website for that. Just so you're aware.
That is correct. We're searching the like-minded counselor that would like to work with us.
Yes, beautiful. Well, thank you so much. We are very grateful to be here. We started this last year, right when the pandemic was occurring, and there were all these lifestyle changes. And it's been an honor to be part of this journey with everyone. And stay posted for the next heart-to-heart conversation. May you have a lovely day. We will be in touch. Thank you so much. Bye.
Thank you.